Wednesday, Medical Monday. When you have a prenatal ultrasound, you say a prayer and hope for the best. Even though our next guest knew their baby would have some issues, the good news is there are doctors who can fix those issues. July is National Cleft Craniofacial Awareness Month. A cleft lip or palate fall into that category. Dr. Matthew Greives is a pediatric plastic surgeon with UT Physicians and assistant professor at McGovern Medical School. He's here with his patient, 3-year-old Camden, and Camden's parents, Courtney and Freddie. All right, good morning.
Good morning.
Okay, let me start with the ultrasound. That's one of those things that makes us nervous and at the same time can bring us lots of relief.
Right.
Did you have any idea what they were talking about when they said we see something?
No, not actually. It wasn't, they explained it, but I was still in a state of shock and disbelief because I didn't really understand. And Camden was very active, so he always had his hand in front of his mouth, so they had to kind of wait for him to maneuver to then actually see it. But
he was very active, I can't believe.
But when they explained it, I still was kind of unsure exactly what that would entail.
And you had no idea either?
No, ma'am. Just during the process, you just kind of be like, you know, out in the whim, like, but then when they come in and talk to you about it, you're kind of more reassured about, you know, what the procedures are going to be.
Yeah, you know, I think a lot of us have seen cleft lip, cleft palate, but didn't really quite understand what it is. So what is it? Is it something that's genetic? Is it something, what happens?
So there's multiple kinds, but it's one of the most common birth defects. It happens in almost 1 in 700 kids around the globe. Most cases are sporadic, meaning you didn't have any family history, you didn't do anything, and you just won the lottery,
right.
and this happens. But there are some genetic syndromes that run in families, and if someone in your family has a cleft lip or palate, you do have a higher risk.
Okay, so let's go through cleft lip. What does that look like?
So a cleft lip is actually a separation or a gap in the lip itself, and that can involve even the base of the nose. So the lip itself is wider, the nose is wider and kind of twisted, and then whether it involves the palate, that extends kind of back through. So it can take, and in Camden's case it did, it involved his lip, his nose, his gum ridges, so he may be missing some of his teeth in there, and then both the hard and the soft palate. So it's a gap that goes all the way back, which you can see in some of his pictures from when he was a baby.
And it's not just aesthetic. That's the concern.
It's not. And so we focus so much on what they look like. So how does the lip and the nose look like? But your palate's important in how you feed. So kids that have cleft palate, they can't breastfeed or use regular bottles. So we have to use specialized bottles to feed them. They can have difficulty with speech. And so, although he's talking up a storm today, you know, a lot of the kids need speech therapy and have difficulty speaking. And then, you know, their teeth, because this is involved, they can have issues with, you know, needing braces, other jaw surgeries, and issues with just their taking care of their teeth.
Yeah. Well, Camden, how old are you? 3. Oh, put that microphone up so I can hear you now. Yes. Oh, yeah.
He followed your instructions.
Yes, he did. He did exactly what he was supposed to do. How old are you?
3.
Yes. So, Camden, can you tell us what was going on with your lip? It looks perfect now. He's looking at him. Yes, you don't know? He's like, I'm just busy being a handsome man, right? Okay. He sees himself on the monitor there. He's like, who's that handsome man right there? Okay, so it's about 20 weeks into pregnancy that you can pretty much see this. But the way to fix it involves what? Is it sometimes just a one-time surgery, or is it a process?
It can be, in Camden's case, we like to do a 2-stage surgery because his cleft was a little wider than what we normally see. So we did a first stage to kind of surgically glue the lip together, and in the second stage came back and did a formal repair. So that was at around 2 to 3 months for the first surgery and about 6 months for his final lip surgery.
Yeah.
And then the cleft palate, we usually wait till about a year because that's when kids start talking, and so we want to make sure we repair the palate so when they do start talking, they have all the proper anatomy and they can say the words the right way.
Yeah. When you hear surgery and your children, that's always very scary.
Right.
And that's why it's so important to have a doctor like Dr. Greives who
definitely
can communicate with you and remove the fear.
Exactly. Yeah, and that's one of the things that I loved about Dr. Greives, because he walked us through each procedure and each process, and he also made sure that any concerns that we had were heard, because originally the process for him was supposed to be this NAM, and he hated it. And Dr. Greives actually suggested lip adhesion surgery. Even though it was an additional surgery, it really helped him out, and he took to it a lot more better. So I thank Dr. Greives for that.
Yeah. What's your advice to other parents? I think no matter what happens, oftentimes parents feel like it's our fault, right? There's something that we did wrong.
Right,
Did I take
right.
one less prenatal vitamin, right? So what's your advice to other parents who are dealing with this?
Just to take it one day at a time, honestly. It's going to seem overwhelming, and you're going to feel it more than they do, obviously. He didn't even really know what was going on. He just went with it.
Like you said, I don't know.
Right. As long as we were good, he was good. So just take it one day at a time, voice your concerns if you really are concerned about it, and really talk to your doctors.
And I would imagine earlier you know about this and get on it, the better.
Absolutely. You know, it's once you can imagine having a newborn where you're super tired and can't think to take care of yourself, let alone to learn information about something complex. So we really prefer, once you have an ultrasound and you're concerned that there's something there, come see us at one of our UTP clinics. And one of the nice things in our integrated clinics, you can actually see your OB in the morning, have your ultrasound.
Talk about UT physicians, because it's a little bit different setup, right?
They're multi-specialty clinics, meaning there's all kinds of different specialists and general practitioners all over the city. There's over 100 clinics in the Southeast Texas region.
And you can hand off to the next expert if you need to.
And you can literally go and see your OB in the morning downstairs in our clinic, and then come take the elevator right upstairs and see us in the Cleft clinic in the afternoon, or whatever your issue is. And there's pediatric providers, adult providers. I think we're over 1,500 providers over the Houston region. So it's a large organization, and hopefully provides kind of a comprehensive care for people.
I won't be seeing an OB in this lifetime again. So Camden, can you come over here? Because I just want to hold a little boy again, because mine's 14 and needs deodorant now. Okay. Oh, look at that. Oh my gosh. Oh, for more information on UT Physicians, Dr. Greives, and Cleft Lip and Palate, you can log on to utphysicians.com or give them a call at 888-4UT-DOCS. That works out to be 888-488-3627. Can we trade?
Anytime.
I think I need a co-host. We trade almost. Okay, my 14. Give me your address. My 14-year-old will be at your house this afternoon.